You're 76 years old. You feel good. You sleep well. You still enjoy your daily walks. You spend time with family, take care of your home, and for the most part, life feels stable. Then during a routine checkup, your doctor says something that sounds completely reasonable. Let's run a few extra tests just to be safe. Nothing hurts. Nothing feels wrong. You agree. A few weeks later, one of those tests finds a small abnormality. Then comes another test, then a specialist, then a procedure, then complications. And suddenly, the biggest threat to your health isn't the condition they found. It's everything that happened after they found it. Now let me be clear. Preventive medicine saves lives. Screening tests save lives. Modern medicine has accomplished remarkable things. But after age 70, something important changes. The question is no longer, what can we find? The question becomes, what happens if we find it? And surprisingly, very few people ask that question. Today we're going to discuss 5 common medical tests that many experts believe deserve a second look after age 70. Not because they're always bad, not because doctors are wrong, but because the balance between benefit and risk changes dramatically as we age. And at the end of this video, I'll share 5 simple questions that could completely change the conversation during your next doctor's appointment. Stay with me because number 3 is one of the most common tests ordered in America, and what the research shows may surprise you. Before we begin, tell me where you're watching from today. I always enjoy seeing how many different cities, states, and countries are represented here. Let's get started. Number 1, routine colonoscopy. After 75. Let's talk about a woman we'll call Margaret. Margaret was 78, independent, active, healthy. She had undergone routine colonoscopies throughout her life. Every result had been normal. No cancer, no concerning polyps, no family history, nothing unusual. During a routine appointment, her doctor suggested another colonoscopy. Margaret agreed. After all, she'd done it before. What could go wrong? The problem wasn't the procedure itself. The problem was the preparation. The powerful laxatives required before the exam left her severely dehydrated. She became dizzy, weak, confused. Her daughter eventually rushed her to the emergency room. Instead of returning home after a routine screening, Margaret spent several days in the hospital recovering from complications related to dehydration. And here's the important part. For many adults over 75 who have had normal screenings and no symptoms, routine colonoscopy may no longer provide the same benefit it once did. Why? Because colon cancer usually develops very slowly. Finding and removing precancerous growths in your 50s and 60s can absolutely save lives. But after 75, especially when previous screenings were normal, the potential benefits often become smaller, while the risks become larger. Older adults are more vulnerable to dehydration, electrolyte imbalances, complications from sedation, and in rare cases, tears in the colon that require emergency surgery. The lesson isn't that colonoscopies are bad. For the right person, they can be life-saving. The lesson is that every test should have a purpose. If you're over 75 and your previous screenings have been normal, ask your doctor, what specific benefit are we expecting from this test at my age? That single question can completely change the conversation, because after 70, healthcare should focus on quality of life, not just finding abnormalities. Number 2, aggressive cancer screening in low-risk adults. Few words create more fear than cancer, and that's understandable. Almost everyone knows someone whose life has been affected by it, which is why this topic deserves careful attention. Let's imagine a man named Robert. Robert is 80 years old, still active, still independent, still enjoying life. During a routine physical, his doctor orders a PSA blood test. The result comes back slightly elevated, nothing dramatic, just a little higher than expected. But now the process begins. More testing, a specialist referral, a biopsy, eventually a diagnosis, a small, slow-growing prostate cancer. At this point, most people assume treatment is the obvious next step. But here's the question few people ask. Would this cancer ever have caused a problem? Many prostate cancers discovered in older men grow so slowly that they never become life-threatening. Studies have shown that a large percentage of men over 80 have prostate cancer cells present without ever knowing it, and without ever being harmed by them. Yet once the word cancer appears on a report, fear takes over. Treatment begins, surgery, radiation, hormone therapy, each carrying its own risks, fatigue, urinary issues, loss of energy, reduced quality of life. For some older adults, the treatment ends up causing more suffering than the cancer ever would have. Now let me be clear. This doesn't mean cancer screening is wrong. If you have symptoms, a strong family history, or high risk factors, screening may be extremely important. But if you're healthy, symptom-free, and in your late 70s or 80s, it's worth asking, if we find something, would we actually treat it? Many people have never considered that question, yet it may be one of the most important questions you can ask, because finding a disease and benefiting from finding it are not always the same thing. Number 3, routine cardiac stress testing without symptoms. Now let's move to the third screening. This is the one that surprises many people, because on the surface, it sounds incredibly responsible. Your doctor says, "Let's check your heart just to make sure everything looks okay." Seems reasonable, right? After all, heart disease remains one of the leading health concerns for older adults. But here's where things become more complicated. Imagine you're 74 years old. You have no chest pain, no unusual shortness of breath, no dizziness, no symptoms that suggest a heart problem. Yet a routine stress test is ordered. The results come back slightly abnormal. Now everyone is concerned. You, your family, your physician. Additional testing follows, maybe a CT scan, maybe an angiogram, possibly even a cardiac catheterization. And here's the challenge. Stress tests can produce false positives. In other words, they can suggest a problem that isn't actually causing harm. But once that possibility appears on a report, it becomes very difficult to ignore. The result is often more testing, more procedures, more risk. Several major studies have found that many stable heart conditions discovered in symptom-free patients can often be managed successfully with medication, exercise, blood pressure control, and healthy lifestyle habits, not necessarily with invasive procedures. That's an important point, because many people assume that more intervention automatically means better outcomes. But that's not always true. Sometimes the biggest improvements come from the simplest actions: daily walking, better sleep, healthy weight management, controlling blood sugar, managing blood pressure. These habits consistently reduce cardiovascular risk. So before agreeing to routine heart testing without symptoms, consider asking, how will this test change my treatment plan? It's a simple question, but it can reveal whether the test is truly necessary. Number 4, bone density testing. That automatically leads to medication. Let's talk about osteoporosis. Bone loss is real. Fractures can be devastating. No one is arguing otherwise. But the conversation becomes interesting after the diagnosis. Imagine a healthy 77-year-old woman named Helen. She's active, independent, still enjoys gardening and daily walks. A routine bone density scan shows mild bone loss. Within minutes, the discussion shifts toward medication. But here's something many people don't realize. The greatest predictor of a fracture isn't simply bone density, it's falling. Think about that. A person with weaker bones who never falls may never suffer a fracture. Meanwhile, someone with stronger bones who falls repeatedly may face a completely different outcome. That's why fall prevention deserves far more attention than it often receives. Balance training, strength training, vision checks, removing trip hazards from the home, reviewing medications that cause dizziness. These interventions can dramatically reduce fracture risk. And unlike medications, they come with virtually no harmful side effects. Now, medications absolutely have a place. Some patients genuinely need them, but every treatment decision should include a discussion of benefits, risks, and alternatives, because informed healthcare is always better healthcare. Number 5, routine carotid artery screening without symptoms. This final screening may be the least known, yet it may also be one of the most misunderstood. The carotid arteries are major blood vessels in your neck that supply blood to your brain. The theory behind screening sounds simple. Find a blockage, prevent a stroke, makes sense. But reality is more complicated. Many older adults have some degree of carotid artery narrowing, and most never experience symptoms, never suffer a stroke, never develop problems from it. Yet once a blockage is discovered, it becomes very difficult psychologically to leave it alone. Everyone wants to fix it. The problem is that procedures designed to correct carotid narrowing carry risks of their own, including, ironically, stroke. That's one reason many medical organizations do not recommend routine carotid screening for healthy adults without symptoms. Instead, they emphasize controlling the factors that truly drive stroke risk: high blood pressure, smoking, diabetes, physical inactivity, atrial fibrillation. These are the areas where some of the biggest health gains can be achieved, not through more scans, but through better management of known risks. The 5 questions every adult over 70 should ask. Now let's get to the most important part of today's discussion. Every time a screening test is recommended, ask these 5 questions. Question number 1, what is the likelihood this test finds something that would never actually harm me? Question number 2, if we find something, what happens next? Question number 3, what are the risks of treatment compared to the risks of monitoring? Question number 4, will finding this improve either my lifespan or my quality of life? And question number 5, is there a less invasive way to achieve the same goal? These questions change conversations. They shift the focus from finding abnormalities to improving outcomes, and that's what matters most. Final thoughts. I want to leave you with one simple idea. Successful aging isn't about chasing perfect test results. It isn't about finding every possible abnormality. And it certainly isn't about spending your life moving from one medical appointment to another. Successful aging is about protecting what matters: your independence, your mobility, your energy, your ability to enjoy ordinary days, because ordinary days are what make up a life. The wisest physicians understand something many people eventually learn for themselves. More medicine is not always better medicine. More testing is not always better testing. Sometimes the most important question isn't, what else can we find? It's, will finding this actually help me live better? After age 70, that may be the most important health question you'll ever ask. If today's video gave you a new perspective on healthcare and aging, leave a comment below. Have you ever had a routine test that led somewhere you never expected? I'd genuinely like to hear your story. Take care of yourself, stay informed, and remember, the goal isn't simply to live longer, the goal is to live better.